So, what actually is the ASE Framework? You've heard me talk about it, but let's get into what it looks like in practice. Most OET candidates fail because they treat the speaking test like a language exam. They're so worried about grammar, vocabulary, and sounding smart that they forget to sound like a doctor. The ASE Framework is our way of stripping all that away and getting back to what you do best, being a clinician. It stands for Analyze, Script, and Execute. First, analyze. Before you say a single word, you have to stop and analyze the scenario. Most people jump straight into the role play, panic, and start talking. That's a mistake. When you use the framework, you're looking for the clinical goal. Is this a history taking? Is this a discharge? Is this an angry patient? Once you know the why, the what becomes easy. You aren't just reciting a script, you're solving the clinical problem. Second, script. And I don't mean a written script you memorize. I mean scripting your authority. This is about how you guide the patient. A student waits for the patient to lead. A doctor leads the patient. In this phase, we look at the phrases and the structural markers that keep you in control of the consultation. You aren't asking for permission to continue. You're steering the conversation to the diagnosis. Third, execute. This is where the rubber meets the road. It's the delivery. It's the tone, the empathy, and the pacing. It's about executing that clinical interaction naturally, like you do in your own practice every single day. When you execute well, the grammar and the vocabulary don't matter as much because the examiner is too busy watching a competent doctor doing their job. That's the ASE Framework. It's not about being a better English speaker. It's about being a better doctor in a test environment. If you want to see how we apply this to the specific scenarios you'll face in the OET, that's exactly what the OET Medicine Speaking Blueprint is for.